Homelessness has been a concerning issue for many in Tupelo. That's driven by high housing costs, and inflation plays a role in increasing those costs. Good Samaritan Health Services is hosting an important meeting tomorrow in an effort to prevent individuals and families from becoming homeless. And joining us now is Hannah Meharry, the executive director. How are you doing, Miss Hannah?
I'm great. How are you doing? Thank you for inviting me. I really appreciate it.
Thank you for being here with us. So when it comes to homelessness in Tupelo, it's been a concerning issue. What does it look like right now?
Oh, thank you for asking. Homelessness is very transient in nature, as we know that people come into our community, they leave our community. We did an informal point in time count, which is our annual census, in December to prepare ourselves for our formal count, which happens at the end of January. In December, we had about 82 individuals that were considered homeless, and then at the end of January, we're on target to have a very similar number. They will not be formalized until the end of the spring, though. So I would say if someone asked me how many homeless individuals are in Tupelo at this moment, I would say 82 to 100.
Wow, so that's absolutely some good numbers to hear. Now, when it comes to this rapid resolution training, tell us a little bit about that.
Rapid resolution is a technique that we borrowed actually from the VA, or the Veterans Affairs system, when they put out their best practices onto addressing veterans homelessness. And it's a way to rethink your initial contact with someone who's suffering from a housing crisis or from any type of crisis. And it's a way for you to do a motivational interview where you can really define that person's issue and what resources they might have at their disposal that they're not able to consider because they're in a panic mode, they're in a crisis mode. So I would say rapid resolution started as a housing intervention. It started as a way to divert people from shelter, divert people from unsheltered homelessness, like living in a car, living under a bridge, but it really can be used to empower individuals and empower community agencies that receive crisis calls on how to address community needs. Like you see on the screen, it reduces shelter overcrowding and encampments, and that's one thing we've noticed over the last year. Our number of encampments has gone down. We are really involved with our code enforcement agencies, and if you are interested in learning more about homelessness or how to divert people from homelessness, please join us tomorrow at Good Samaritan Health Services at 420 Magazine Street at 2 p.m. You will learn a lot. I promise you, you will leave with a toolbox full of tools to take back to your agency, your church, your friend group, whatever it might be. And so when you encounter someone that's going through crisis, you'll know how to appropriately address it.
All right. Well, Hannah, thank you so much as always for joining us.
Yeah, I appreciate it.
Thank you. Well, working